Hi, my name is Chadwick Prodromos. I'm a board-certified orthopedic surgeon, sports medicine specialist. My journey into sports medicine began with a bachelor's degree many years ago at Princeton, an MD at Johns Hopkins, residencies at Rush and the University of Chicago, and then an orthopedic and sports medicine fellowship at the Harvard Medical School and Massachusetts General Hospital. From there, I embarked on a lifelong career in sports medicine. I became introduced to the Echolight and bioDensity while in a trip in London. Saw a demonstration, was presented with the idea that there was real data showing that it helped osteoporosis. I was quite skeptical because it was presented as something that in 10 or 15 minutes a week could reverse osteoporosis. However, there was data and papers, and they were given to me, and I read them, and they were good research. We publish regularly. We have a 501c3 foundation that publishes, so I spent a lot of time reading papers. And I was very impressed and surprised. And I will tell you that I have had two patients who were going to go on anti-resorptive drugs that I counseled against it, who coincidentally, when I got back, told me that they had both used this technology and in both cases had reversed their osteoporosis. So this to me was something that was quite interesting, quite useful. The Echolight, similarly, is a device that uses ultrasound and purports to evaluate bone density like a DEXA scan, but in a more convenient way and without radiation. So DEXA scans are not expensive. They're not all that inconvenient. The amount of radiation is small, but I will tell you, we tend to have a difficult time getting people to actually schedule and do them. They can be done without a prescription. I know in Chicago, when I got back, I had an Echolight scan there, and I was kind of interested to test the results on myself. So when I came back, I scheduled a DEXA scan, and there was one place that's open to the public. Their next appointment was a month away. I have a friend who operates a facility who got me in right away. But the point is, it's not real convenient. In fact, we do stem cell work regularly. We publish in the space, and I had been interested to get DEXA scans to see the effect on bone. We do multiple other kinds of testing. And I had tried at one point to get people to get a DEXA scan, and basically it just wound up being too much trouble. I will tell you that the Echolight results were very similar to my DEXA scan results. And I will tell you also, I had never really tested myself. I fit, work out regularly, and my results were okay, probably less good than I would have thought. So it was of interest to me and something that's motivating to me, in fact, to do the bioDensity, which now I intend to embark on. So as far as the need for this kind of thing, orthopedic surgeons are the experts on bones and on osteoporosis. Osteoporosis tends to be a little neglected because orthopedic surgeons are the people that are trained in bone physiology, bone metabolism, osteoporosis, more than any other specialty. However, most orthopedic surgeons have as the focus of their practice performing orthopedic surgery, not really osteoporosis. So osteoporosis winds up being a little bit of an orphan in the real world. Most osteoporosis, as a practical matter, is treated by primary care doctors. And primary care doctors will get DEXA scans, and in general, they recommend pharmacologic solutions, generally anti-resorptive drugs. These are drugs that decrease the resorption of bone and can have a beneficial effect on DEXA scans or on Echolights. I will tell you that these drugs have side effects, and I will tell you that I am not a big fan of these drugs in general, and most of my orthopedic colleagues I don't think really are either. And we have actually spent a lot of time in this space researching these. So these drugs decrease the body's scavenging of defective bone. And the result is that the DEXA scan shows greater density. And there are studies showing decreased fracture rate, but we have recalculated the data from these studies, and unless you're dealing with selected high-risk populations, the decrease in fracture per year is something on the order of 1%, perhaps less. The other part about this is that these drugs, actually there's a study showing that at 10 years use, they increase fracture rate, and they're only recommended to be used for something like 3 to 5 years. The other part of this is that while they do increase density, the increased bone is probably not as good as the native bone, because this is bone that your body would have gotten rid of with scavenging cells called osteoclasts that these drugs inhibit. There is a drug that promotes the formation of new bone. It's called teriparatide. The trade name is Forteo. It's a part of the parathyroid hormone. However, again, in the real world, this drug, which I think is better, is very difficult to get. The usual criteria for insurance companies are that you have to have failed treatment on anti-resorptive drugs, including fractures. So as a practical matter, people tend not to get it. The off-the-shelf cash price for this drug, and it's a 2-year regimen, is it's about $72,000 for it's $3,000 a month for 24 months if you're not getting it paid for. So the drug, in my view, is underutilized. I will tell you also, again, regarding the anti-resorptive drugs, some of the side effects that we're familiar with, they can cause an increase in something called atypical femur fractures. In particular, one that's called a subtrochanteric fracture. These require surgery, and subtrochanteric hip fractures are the hardest, technically, hip fractures to treat. I actually had a patient who was on vacation, and a gust of wind came along, and she had been taking one of these drugs, and it just kind of knocked her sideways. Didn't even knock her down. She fractured both femurs, both hips on the spot, and had to be airlifted to a major city to get fixed, which she was. I will tell you, my wife, who is a dentist, had for many years subspecialty referral practice treating TMJ problems. And a patient who I will never forget was referred to us, which was supposed to be a TMJ problem. My wife was the 7th doctor she had been referred to. Nobody knew what was wrong with her. She was in her 80s. When we saw her, she looked terrible, very sick. She had swelling in her jaw they thought was TMJ. She had seen internists, periodontists, dentists, oral surgeons, and ENTs. We got an MRI and found out that the cells in her jaw were dead. The only things that would cause this would be a sarcoma or a thing called avascular necrosis of the jaw. It turned out it was avascular necrosis of the jaw. It was caused by one of the anti-resorptive drugs, and what had happened is the cells in her jaw on one side were dead, and she had gotten a secondary superinfection with the bacteria, which made her very sick. She was admitted to the hospital, got a biopsy, found this out, started her on antibiotics, and she got better. But she was in terrible shape. We were very worried about her even surviving prior to this. So the counter argument to this would be that these complications are not frequent. And they're not frequent. But when they occur, they can be severe. And as we researched this, we found this woman had had an extraction, and the complications are more severe, more frequent after extractions. And there's an old saying in surgery that if you have a 1% complication rate, that complication is 100% for that patient. So we have seen other people as well. So, having a treatment, bioDensity, that can actually reverse osteoporosis with really no side effects, it has to be carefully applied, is extraordinarily appealing. And there are more applications for this than you would think. So my career centered a little on developing some new techniques for ACL reconstruction using hamstring tendons, which resulted in my being asked to put together the first comprehensive textbook for orthopedic surgeons on the ACL. This was first published in 2008, second edition 2017. So very comprehensive textbook, more than 100 chapters. We purported to have basically all of the world's relevant information on the ACL in one place. Well, one thing that we discovered is that, and there are papers on this, that there is a significant incidence of osteoporosis of the heel bone, the calcaneus, in the affected leg of patients with ACL reconstructions. So they get their ACL reconstructed, but they get osteoporosis of the heel and maybe of the leg as well. And actually this can occur after any treatment where you're off of your leg some. So then if you have that, what do you do about this? Well, if it's a young person, usually what's done is not much at all. And if they're in their 20s and 30s, it's maybe not that severe, but it probably gets worse over time. So something like this is extremely appealing. That is the bioDensity as a way to treat this. Another area of sports medicine that's relevant is stress fractures in young females. So female athletes who get low body fat tend to get low estrogen. Many times they'll have abnormal menstrual periods reflecting this, but oftentimes they don't, and they don't really know unless you actually measure the estrogen level. So another area where osteoporosis is relevant in sports medicine is stress fractures in particular young female athletes. So it turns out that female athletes in endurance sports, runners, soccer players, in many cases produce less estrogen than others. It is also the case that females with quite low body fat tend to produce less estrogen, and not extraordinarily low, but just low. And the two of these things together produce an additive incidence of osteoporosis. Now, sometimes this manifests as decreased or irregular menstrual periods, but often it doesn't. So unless you're actually testing for estrogen, you wouldn't know. But what happens is that if you're making less estrogen, you're prone to stress fractures. And the incidence of stress fractures in young female endurance athletes has been gradually increasing. This is further aggravated, abetted by the fact that young people these days eat far less dairy than they used to. So you have calcium intake being substantially less, and in these athletes, estrogen often being substantially less. It can manifest as stress fractures. Sometimes these can be serious. They can be in the hip, and I've treated a number. And on top of that, if you have a female athlete who's 14 or 18 or 21 or whatever and has this, it's a significant problem in and of itself. But bone density tends to peak in youth and then get to be less later. So even if their bone isn't dangerously low at that age, it's going to wind up being significantly lower when they're 40 or 50 or 60 in the peak age for osteoporosis than they would have been otherwise. And this basically is an unaddressed problem. And in the sports medicine realm, I may be wrong, but it was never anything that was high profile that I could see. The orthopedic sports medicine journals tend to concentrate more on knee and shoulder injuries, the kind of thing that I've been doing for decades. There are people that deal with osteoporosis, but it just isn't that much addressed. But this is a significant public health problem. By the way, not just females. Males at all ages have more dense bone than females, but young males now have softer bone than females in general, because of the decreased calcium intake. So, and I will tell you that, obesity is not good. Obesity tends to produce denser bone, so not every young person has soft bone. But the point is, people should be screened a lot more than they are. But, trying to get DEXA scans as part of a high school screening program, it's lower priority. It really isn't going to happen. There's a lot more interest in people that get congenital heart problems, and should you do an echocardiogram, that kind of thing. So the Echolight, no radiation. And even though the radiation in DEXA scans is very low, if you're doing it every year, who knows? And psychologically, it's not something people necessarily want to do. So the Echolight is something that has no side effects, that gives you valid bone readings. And, this should be in pediatricians' offices as well, because osteoporosis can be addressed with diet and exercise. Now it can be addressed with bioDensity. So you have a way to identify the problem that is greatly underreported, and not just older people, but also younger people. I mean, it goes without saying that older people have problems with osteoporosis. And, it's interesting, the life expectancy in the U.S. has actually been going down a little bit in recent years, but people still live. There's even a new category called living sick. People live, but they're not in good health, and they're in nursing homes, and they're bedridden. And nobody is getting, I don't think, routine DEXA scans on nursing home people. But fragility fractures are common if you fall out of bed or whatever. So doing a screening with an Echolight for this population, I think could be a fantastic thing, and particularly since there's a way to treat it with the bioDensity. So there are huge applications for this, that the bioDensity can actually reverse osteoporosis in a short period of time. And again, you have to be careful to do it in a way that is not stressing people. I think it's remarkable. I tried it myself when I was in London. It's atraumatic, doesn't take much time. So I don't know much about the bioDensity Performance Systems company, but they tell me that they are getting more machines out there, both for diagnosis and for treatment. And I think it is a fantastic public health breakthrough.